First of all, thanks real briefly to WQLN and Jocelyn for putting this on. I think we're all very excited about delivering this discussion, and I look forward to some good feedback and dialogue. I would also like to point out that when we go into the discussions and the breakout rooms, all questions are good questions. There should be no out of bounds, and that's the intent of this discussion. So getting right into it, our panelists, I have some questions here for you that I'm going to throw at you to respond. And Dr. Alba, you are on the top left of my screen, so I'll start with you if you don't mind. The question is, what do you think the difference is between normal behaviors and feelings and mental illness? What's the difference? How would one understand whether it's a more readily available emotion of sadness or something like that, as opposed to a mental illness? What would you say to that?
So one of the things that really highlights that for me is how does it impact functioning? Is there impairment in being able to be with your family or be with friends, be in the community? How are you doing in school? When there's interference with that functioning, then I think we are looking at moving beyond what might be typical.
Thank you. So, really functioning, and is it impacting quality of life, lifestyle, and day-to-day operations from a functional level? So I appreciate that feedback, and thank you, Dr. Alba. Let me switch to Patty Strickenberger for a second. So Patty, how do you think that the pandemic has impacted mental health? We've heard in the news that there's more mental health awareness happening as a result of the pandemic. From your perspective, how does the pandemic fit into mental health?
Well, the pandemic has had a significant effect on mental health of school-age students. Most specifically, there was a 2-year period of either in school or partial attending school. And there are a lot of students who have missed basic socialization skills that they needed to be more resilient, to problem solve. And it's becoming very, very apparent that that they're lacking in those skills. And we just had some information on the PAYS report, and specifically, there's a significant increase in antisocial behavior during the pandemic period, which comes not just from the students, but the parents as well. So that has significantly impacted mental health. And they're still trying to navigate getting back into structure and routine. And it's been very difficult for the students.
Thanks, Patty. And for those of you that are not aware, PAYS is a survey that's done through the state that really allows school systems primarily to survey students and really take a temperature on the climate, the culture, and some of the needs that may be identified within a specific school system and or a county or even across the state. So thanks, Patty. Appreciate that. Let's see here. Who's Tracy? If I can go to you for a second. What does a parent or a guardian or caregiver or somebody who knows somebody that may be, as Dr. Alba said, having some significant functioning issues due to emotional state and or mental illness, what do? How do they, what's the first step that somebody should be aware of?
As a parent of 2 children that have mental health, and I think somebody said it in the video, is finding your person. Parents really need to, reach out to other parents that might be in the same boat as they are, and also talking to their schools. and trying to find out what resources are out there in their communities. Sometimes we as parents, we don't know what we don't know because we're just now getting a diagnosis or we're seeing our children struggling. So oftentimes we don't know what to do. So we're looking out into our community and trying to find those resources, talking to our teachers, you know, and trying to find out how we can support our children.
And, you know, I think for me, the one thing that you said, my experience of working in our community is that people just don't know what they don't know. And, you know, I think that sometimes that is a significant hindrance and gets in the way of taking that initial step. So, you know, I think figuring out, you can always ask somebody at a school setting and or contact your local providers that will steer you in the right direction. So I appreciate that. Dr. Dixon, how are you today? I'm going to come to you next. So how do you find a therapist? So let's say that we've moved past the question that I just asked Tracy, and you know, there really is a need to find a professional caregiver to provide the support that so many of those individuals that we saw on that screener mentioned. How do you do that? What would your feedback be to the group?
Yeah, thanks for the question. You know, there's a lot of great resources out there, but certainly, you know, it's not necessarily well known if you've never navigated that. Dr. Abbas, I put in the chat, I'm thinking she's referring to this. Your primary care physician obviously is a great place to start. It's where children may, you know, on a regular basis have contact with their doctors. And so being able to talk through what might be and look at distinguishing what may be some challenging issues versus some normal issues and what those resources are. I think, again, for young people, they're in school. So another great resource to them is their school-based contacts, whether that's a school counselor, whether they have SAP or other types of resources in the school. They're great sources to be able to help them navigate that and you know, move through that. And certainly there are other community resources, but that to me would be a great start, looking at their primary health care physicians, and then also looking within the schools at those resources that's available to them. And many times their school counselors may actually be dually trained in terms of just having that background. So really may appreciate what those service systems are, or the system of care that may be available to children and families.
Thanks for that. And, you know, I appreciate the PCP comment. You know, certainly that's a resource, and you had mentioned in school. So Patty, if I could come back to you for a second, can you give us a brief overview of what student assistance program, what that is, and you know, what does that mean for school age students?
Well, the student assistance program is available in all middle school and high schools in Erie County at this point.
Public schools, correct? Or is that
excuse me?
Is that public schools or all schools?
Yes. Well, all public schools. The public schools in Erie County, mostly, as I know at this point, have full-time staff, trained mental health therapists within the schools on a daily basis. Now, some of the county schools, it's a limited basis. It's more of you know, a couple days a week. But what the student assistance program is, it's a specifically designed program that encompasses everybody within the school. They usually have a building educational support team that identify any barriers, whether it be mental health, drug and alcohol, social, emotional issues, abuse, whatever the issues are that are interfering with a student's ability to perform academically and be resilient and be successful. Anybody can refer to someone like me, which is a mental health therapist of the school, and we do a lot of research. We gather information on that student. We gather about how they're doing academically, how they're doing socially, do an assessment with a student to see, you know, gather information from them. And then the team meets and we make recommendations and kind of formalize an action plan or treatment plan to how we are going to help them be successful in school. And in many, many cases, that entails referring for mental health services. within the community or in the school. We have, most of the schools in Erie now have community-based, school-based programs where a lot of the agencies are coming into the school and providing direct mental health services in the school setting. The counselors from the therapists from places like Safe Harbor are actually coming into the school. And once they've been referred, we can hook them up, and then they are actually receiving services directly at the school. And many times maybe that referral is to an outside agency because it's a higher level of care, whether it's an acute partial need for intervention, a blended case manager, whatever the service is going to best help that student be successful. It can be academic referrals as well, but for someone who's a student assistance program, it's usually a mental health intervention.
Thanks, Patty. That was, I appreciate that follow-up from Dr. Dixon's comments. And I also heard you say that it really is a hiccup in functioning, which goes back to Dr. Alba's point as well of what truly differentiates between possibly onset or identification of mental health illness as opposed to feelings of the blues that may be more of a passing thing than a significant issue. So thanks for that. Hi, Paula. I didn't forget about you. My question for you, Paula, is, how does learning that mental illness is a health condition like any other condition possibly change the way we think of mental health illnesses? So how does understanding what mental health illness really is impact the way we navigate through it?
I think that's a good question, Nick. When we help our kids and when we help the parents look at it that way, I think it helps to take away some of the stigma of mental illness, because we have oftentimes in our residential programs, you have kids that aren't interested or don't want to take medications because of what that represents to them, that they're crazy. And sometimes that's the way kids think about that. And that can come from their community, that can come from even, their peers, people they hang around with. But just to understand that it can be a health condition normalizes it a little bit more. They get to look at that sometimes we need help when we have a condition, whether it is a medical condition for diabetes or asthma or whatever. Sometimes those conditions require medications, or they might require therapy, just as anybody that has a mental health condition. The therapy, the interventions, the treatments, whether medications are involved or not, all lend themselves to helping to for us to get healthier. And we talk about that a lot in the work that we do with the kids about what we call healthy coping skills. So we use that terminology a lot with them as well, just to help them utilize some things that's going to bring about better results.
Thanks, Paula. I think, for one of the things that I gleaned from our vignette that we watched was really two comments stuck out strong to me, and I think are relevant to the question that I just asked you, which is one, the comment was, "You are worthy of love." And I think that when we're aware that mental illness truly is, something that is not desirable by anybody, but it doesn't mean there's anything wrong with their person. There's something that needs worked out with their mental health state. I think that it allows people to move forward and feel love, experience love, accept love, give love. And then the other comment that I thought was, a very good comment is the person on the video said, you can feel good, once you get the supports that you need. And I think that when you take the stigma away from it and realize that this is similar to any other medical condition, if you have a broken arm, you're not going to set it yourself. You're going to go find somebody that has some support for you. So, you know, I think that speaks volumes. Thanks, Paula. So for our panelists, I will give you a second here to think about what's something you would want to impart to our folks on the call. So this is not really a direct question, but more of an opportunity for you to convey, you know, your something that you want to share with the group here. And for the rest of the group, the panelists, you know, I would ask that you Google them and do some research. We have some outstanding professionals on this panel who are just a wealth of information. So going in no particular order, Tracy, let's start with you.
You know, I think, like I said earlier, if a parent is starting out on this journey of helping their child with mental health, is really encompassing all of our resources. You know, in the very beginning, when I started this, I didn't know any of our services. I didn't know where to start. I did go to my primary care doctor, like Dr. Alba said, but it's really trying to get the resources out better to the parents. Student assistant program is absolutely imperative. I think that is an excellent resource for parents, so that we could start there, but then also giving a lot more information as to what all of these services mean. You know, what is family-based? What is an acute partial? All of these things are thrown out to parents, but they might not understand it. And so they do need to have some resources to explain some of the things of what we have to offer our children.
Yeah, and I would also, first of all, I appreciate that response. So much so that I think the one thing that is important for everybody on this meeting to understand is there's a lot of resources in Erie. There really are a good amount of resources with some outstanding folks delivering those resources. But like everything else, if we don't know how to navigate them and get to the correct people, it can be a daunting task for somebody. So I appreciate those words there. Dr. Dixon, how about anything that you particularly would want to convey to this group?
I think the one thing that I would want to come across, and I think we heard in that some of the comments in the trailer that we saw, the preview, is that oftentimes, you know, people are confused and they're unsure about what's happening. And I just think about the interviews that I've seen with Kevin Hines, the young man who jumped off the Golden State Bridge, and he talked about feeling so awkward and unsure. And, you know, people tend to dismiss some of the things that they saw. And I guess one of the things I would really want to impart to is, like, sometimes people don't know what's going on or maybe struggling. And so doing the outreach to them. And I think we've learned there's certain, you know, resources and tools that train us about doing that and train people across, you know, from lay people to anyone that can make those connections, because we know how important that is. And then encouraging those who are seeking help to really reach out and to look at who might be, you know, champions or allies for them that they can connect with, and that they don't have to, you know, suffer in silence or struggle with that. So to me, that would be the one thing that I would want to impart, is how we go about seeking help and providing those resources or acknowledging those resources, and helping people navigate to the support systems that they need.
Thanks a lot, Adrienne. I think that, you know, from watching that video, the hiding in plain sight, it's such an obvious title for this topic. And, you know, I had a conversation with somebody yesterday that I think highly of as well. And the comment was, it's interesting that we have so many students that are across our county that are still wearing masks. And is that because of the fear of the pandemic, or is it a way to isolate? And I just thought that was an interesting comment based on the current status that we're in right now and the current place that we're in. So going right to left on my screen, Ms. Strickenberger, thoughts that you would want to impart on the group?
The thoughts that I would like to impart is that kids are resilient. And if they can find their person, they will be successful. But they have to find the person, be that person, listen, do what you can to help. And if you don't know what to do to help, is find somebody who can help. Sometimes we don't have the answers. Sometimes the answers aren't easy, but there are so many services within Erie County that you can find them. Just ask somebody in the school system. We work together as teams to find out the answers, and we have lots of resources available, but maybe that's not it. We have to ask, we have to seek out who we can get to help that person, but be somebody's person. And kids are resilient. We can't help them. We just have to identify them. And sometimes that's very hard to do.
Yeah, and I like the way you phrase that. They have to find their person. I think we just saw from some of the dialogue from the video of some individuals who clearly were struggling at a point that have found their person and had the courage to speak up. So I appreciate that response. Paula, how about from you? What would you like to impart on the group?
Well, I heard that the first step is to talk, and that's not always easy for kids to do. We find that many of them lack some trust and difficulty finding words to express how they do feel or sorting through the many thoughts that they have in their head. So I think that it is so important for us or for people that work with the kids, live with the kids, is to be the best possible listeners they can be. Let the kids talk, encourage them, affirm their feelings, and let them know that you want to understand, where they're coming from, what they're thinking and feeling, and just being very open to hearing their stories, and letting them feel like they're being heard.
Yeah, as you're talking, the one thing that was popping into my head is when you said to listen. I think that, it's an important strategy of listening is nonverbal listening. And I go back to some of the common threads that we've heard so far, which is there disruption in functioning? And oftentimes that disruption stems from actions and behaviors, not simply words. And I think that's really nice to have that understanding as well. So thanks, Paula. Stephanie?
Yes, I have a question in the chat. So she asked, if someone is depressed, it may be impossible to feel inclined to find their person. How can we recognize signs that someone might be in crisis or having mental health struggles, so we can step in as that person when the sufferer may be disinclined to reach out?
Well, I'm going to open that up to a panelist member who would like to respond to that. My initial take on that is we always should be assessing those that are closest to us and finding out what they're like on a good day, and then what kind of behaviors and what we see on not such a good day. So I think that's one angle, but I'll ask our panelists. Would anybody care to respond to Dr. Alba?
Yeah, I'll jump in. I think that it is important to, as this title of the film speaks to, and I think some of the panelists have talked about, hiding in plain sight. So we need to do our due diligence in our humanness with each other. If we recognize that someone is starting to isolate, or that they are having trouble concentrating, they're not eating, they are having trouble sleeping, they're more tearful, they're more edgy. If we recognize those things, if we can just say, hey, how you doing, and reach in, because what we want to do is make connection. Isolation is the challenge, And I think we've talked about, you know, trust can be a barrier, and there can be a number of things. But if we lend an ear, as Ms. Paula is saying, to be able to outreach and say, we're here, we're worried about you, and how might we help? What's happening? And be a good listener around that. And sometimes these are planting seeds. It doesn't happen immediately, and that can be the frustrating part.
Thanks, Dr. Alba, and thanks for whomever put the chat question in. But we appreciate that. Dr. Alba, you were the last panelist, though, that I didn't give an opportunity to impart any other comments that you would like to share with us.
Sure. So I was thinking about actually resisting that isolation, the importance of you are not alone. And as part of that, I think about children really find themselves in systems. They are in their family system, they are in their friendship system, they're in their school system, they're in their perhaps church system, their work system if they're a little bit older as teenagers. There's many systems. And then sometimes if they've gotten into trouble, there's additional systems that enter the picture. And so it is important to try to do our best to work together as a team and be coordinated. So I think that that's one of the things. The most important, though, is that the child finds themselves, they are part of a family, and the family is trying to figure this out too. So we can't lose sight of that important component. How do we help also engage them in this process, because they're part of the solution. They're part of the healing. And what are they experiencing in this process? Have they found themselves tipping into areas that interfere with how they're doing? And so it roughens up communication. And so I think that these are areas that I worry that sometimes we might look only to helping the child and make that connection, and we forget about the family system and the rest of the system. But certainly the family system for me is the most important. This child needs to thrive in that system, and the family needs to thrive with them. And what are the interferences? And so that's part of what I think is really important.
Yeah, I appreciate that. I concur and agree wholeheartedly. I don't think it's possible to have a child within a family system who has mental illness for the family not to feel an impact at some level. And, you know, that's important for all of our parents or caregivers that are on this presentation, that, and you're not alone either. That's another, I think another misnomer too, is that because you're in the moment and it feels like either you're helpless, you hate watching the one that you love go through this, that it becomes at some point potentially more inward thinking, like, you know, I'm supposed to have all the answers. Well, just like my analogy earlier, I don't have all the answers for a broken bone. I know my kids have had broken bones, and the last thing I would do is want to set that. You know, I need help and I need some guidance and support from professionals. And I think that's an important message to convey here as well. Well, thank you, panelists, for your wisdom and your input as we've gone through our questions here.